Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Giardiasis is an infection of the small intestine, affecting millions of people each year. It is caused by a microscopic parasite called Giardia, which is often found in contaminated water sources. This parasite is found worldwide, making it a global health concern. It lives in the intestines of people and animals, causing a range of gastrointestinal symptoms. Giardia is protected by an outer shell, which makes it resilient. This shell allows it to survive outside the body for long periods, even in unfavorable conditions. It can even survive in harsh conditions, such as extreme temperatures and chemical treatments. These conditions include chlorinated water, which is commonly found in swimming pools. Giardia infection is common. It is one of the most frequent causes of waterborne illness in the United States. Anyone can get giardiasis, but children are particularly susceptible. They are more likely to come into contact with contaminated feces, especially in communal settings. This might be in daycare centers or while playing outside, where hygiene can be difficult to maintain. Giardiasis spreads through contact with infected feces. This contamination can occur in various ways. One common route is through contaminated water. This can include drinking water, recreational water, or ice. The parasite can contaminate water sources. These sources include rivers, streams, and wells. Food can also be a source of infection. Food handlers who don't wash their hands properly can contaminate food. Fruits and vegetables washed with contaminated water can also carry the parasite. Direct person-to-person contact is another mode of transmission. This is especially common in settings with poor hygiene practices. These settings include daycare centers and households. Some people with giardiasis have no symptoms. They may carry the parasite without feeling ill. However, many people experience a range of symptoms. These symptoms typically appear 1 to 3 weeks after exposure. Diarrhea is a hallmark symptom of giardiasis. The diarrhea can be watery and foul-smelling. Other common symptoms include gas, bloating, and stomach cramps. Some people experience nausea and vomiting. Fatigue and weight loss can also occur. In some cases, the infection can lead to dehydration. Dehydration is a serious condition. It requires prompt medical attention. Section 4. Diagnosis and treatment. This section will guide you through the essential steps involved in diagnosing and treating giardiasis. Diagnosing giardiasis involves identifying the parasite, Giardia, which is responsible for the infection. This is typically done through a stool sample test, where a sample of your stool is analyzed in a laboratory. The test detects the presence of Giardia antigens or cysts in the stool, which are indicators of the infection. In some cases, multiple stool samples may be needed over several days to ensure accurate results. This increases the accuracy of the diagnosis, as the parasite may not be present in every sample. Your doctor may also consider your symptoms and medical history to make a comprehensive diagnosis. Once diagnosed, giardiasis is usually treated with medications that are specifically designed to kill the parasite. These medications are effective in killing the parasite and alleviating the symptoms of the infection. The most commonly prescribed drugs are metronidazole, tinidazole, and nitazoxanide, which are known for their efficacy. These medications are available in pill form, making them easy to take. They are typically taken for several days, depending on the severity of the infection. It is crucial to complete the full course of medication as prescribed by your healthcare provider. This ensures the infection is completely eradicated and helps prevent any recurrence of the disease. Section 5. Prevention is key. Preventing giardiasis involves breaking the cycle of infection. This means taking proactive steps to stop the spread of the parasite. This starts with practicing good hygiene. Simple actions can make a big difference. Wash your hands thoroughly with soap and water. Make sure to scrub all parts of your hands. Do this after using the restroom, changing diapers, and before handling food. These are critical times to ensure cleanliness. Ensure access to safe drinking water. Contaminated water is a common source of giardiasis. Boil water for 1 minute or use a water filter. These methods can effectively kill or remove the parasite. Be cautious when swimming in lakes, rivers, or pools. Natural water bodies can harbor the parasite. Avoid swallowing water in these settings. Even a small amount can cause infection. When traveling to areas with poor sanitation, take extra precautions. Being vigilant can prevent illness. Drink bottled water, avoid ice, and be mindful of food hygiene. These steps are essential for staying healthy. Educate children about the importance of hand washing and hygiene practices. Early education can instill lifelong habits. This can help reduce the spread of Giardiasis in schools and daycare centers. Healthy habits start young. By understanding the causes, symptoms, and prevention methods, we can all play a role in reducing the incidence of Giardiasis and promoting public health. Together, we can make a difference. UMCCC, your ultimate medical consultant connectors.